is very, very common to shart yourself hard on sumo deadlift. That's horrifying, right?
They're like, I didn't think that'd feel like that. All chiropractic works. It's just how you want to apply it.
Welcome to Jacked and Cracked, the podcast where chiropractic care, fitness, and real-life stories come together. Get insights, practical tips, and everything you need to move better and live stronger.
Welcome back to the Jacked and Cracked podcast. I'm Zebulon Thomas, and here is your host, Dr. Max.
Hi, guys. How you doing?
Dr. Max, let's update everybody. You know, it's been a while since we did our last podcast, but we're back in effect. And, we've been doing a lot. You've grown a lot. You've brought in another chiropractor, or two, actually, since then.
Right.
And I've just been busy with films. So, update us a little bit on what's new with you on your end.
Sure. So sorry we've been away for a little while. Just trying to keep our feet steady in the practice. Jacked and Cracked is an idea that Zeb here and I had for something that we could have that would be very tangible and something very real. So what I didn't want to become is a social media chiropractor. I still, at my very core, want to be an authentic doctor of chiropractic, father, husband, business owner. And I want to do all those things so that where any of our topics and professional opinions are coming from is from an actual basis from a practicing chiropractor perspective and a gym owner perspective, and not just from a chiropractor that came out of school, got his hands on some nice recording equipment, or maybe just used their phone and started adjusting people in their underpants. So instead, we can adjust people in our underpants, but it's just not it's not the only thing we do.
And I see a lot of that.
Yeah, it's a lot. Right.
I don't understand.
Again, I always want to make sure that the practice is coming first from the chiropractic practitioner standpoint. And so just stabilizing things here in the practice. We have brought in two new chiropractors, Dr. Stephanie Drozdowski and Dr. Matthew Wentz. And cool story about each of them. Dr. Stephanie is great because she's been in practice actually longer than I have. So she brings a veteran experience, but she's also a wife of another chiropractor. So it's pretty cool. They're in a chiropractic household. And then she has two daughters of her own. So she brings awesome mom energy into the practice too. So keeps the staff on task a little better than I probably do. And she's been great in the practice, and then provides a different perspective as a chiropractor than I do. And by being a female doctor that panders to an audience that maybe I wasn't, which has been great. And then Dr. Matt, you could say he's kind of like my Luke Skywalker. He's been a protege of mine from the get-go. So he started in the practice as a patient and as a gym member, and then decided to go on to school. He went to Palmer College of Chiropractic in Florida, where I went. And now he's interned under us and precepted, which is kind of like a med school resident in their last piece of schooling. If they've completed all of their other requirements, they're able to go out into practice and practice under a practicing provider. And he came here and did his preceptor here. And now he's a full licensed chiropractor himself. So now that the dust is kind of settled and all of that change has taken place, it gives Zeb and I an opportunity to dive back into Jacked and Cracked, which is really fun because it's a passion project for he and I. It's not something we feel like we have to do because we do put the business aspect of what we do out in front. But the cool thing is it's not something we have to do. It's something we want to do. So we can have a lot more fun with it. It doesn't feel like I'm working when I'm sitting here in front of you talking about it.
And I'm excited to see it evolve, because like, where we started, right, was getting our feet wet, right? And obviously all the technology stuff and testing things out and what's going to be our fit for us. So you're going to see us doing, these virtual podcast episodes. Plus we're going to be doing in-house where we're actually at the office with Dr. Max in-house doing some funny stuff. And I say funny because we're not just talking about chiropractic care and fitness, but we're also getting, the comical stuff out of the way because there is a lot of funny stuff out there floating around in the world. But before I talk about that, I do want to say something about having the two new chiropractors. I've been adjusted by both of them. All three of you guys have a very awesome, awesome approach compared to like chiropractors have had in the past. Everyone has their different approach, but I just love the energy you have at your at your practice. And so I encourage people, if you're in the area, in the Strongsville area, definitely stop in and get adjusted by one of these awesome chiropractors, because it's definitely beneficial. And I always get amazing treatment. I really appreciate it. And I get adjusted, once a week, sometimes twice a week, and, I was talking to some friends, and even my brother was mentioning, I said, you should go to a chiropractor. And one of the misconceptions is that, he's not broke, don't fix it. But, you're out of alignment, right? Let's talk a little bit about the alignment of how, if you've never been to a chiropractor, you don't have to have an injury to go to the chiropractor. I go for preventative maintenance and fixing some stuff that I messed myself up on, with my career, but work.
Fair.
So let's talk about that. Like, do you always have to have an issue to go
to the chiropractor? Absolutely. That's a great question. That comes up a lot because, of course, I'm a chiropractor, so I'm going to say, hey, everybody needs a chiropractor. But dissecting that a little further, we can truly be a wellness provider for people. And that's why our office here is called the Healthiest You Chiropractic Center. It's not called the Pain Free You Chiropractic Center. So we don't take a symptom-based approach. Chiropractors can thrive in what I call the fire department lane, where we're putting out fires for you as they come up. But really, a chiropractor's true strength is in fireproofing your house. So trying to prevent those fires from popping up. And really what that breaks down from is the idea that we're influencing the nervous system, and the core of that nervous system is inside your spine and your skull. You've got your brain and your spinal cord, and all your nerves branch out from there. And we're adjusting that spine. Some chiropractors even do cranial work, but we're adjusting that spine, which influences the nervous system. And sometimes that nervous system is producing pain or a symptom for you. Sometimes it's not going to manifest right away. And for example, I would say for the average person, if your bicep muscles were working at 90% instead of 100%, you wouldn't be aware of that. So you really wouldn't be aware that you should be smelling smoke until there's a fire and your biceps start hurting because you got a pinched nerve in your neck. So that's where chiropractic comes into play and kind of manages those things before they truly manifest into a symptom or a fire. And that's where the Healthiest You idea comes from. So here we adjust from newborns all the way to, patients that are 90 plus years old. And it's interesting because you will have patients who say, wow, you adjust a newborn. What kind of back pain or headaches could they possibly have? And in truth, we wouldn't know anyways because they can't talk to us, but that's not typically what you're treating them for. What you're treating them for is usually like a colic situation where, the baby's just fussy and cranky and maybe gassy. And so by adjusting them, we're freeing up the nervous system so that the body can operate the way it's supposed to, the way it's intended to, so it can move that gas through the body and the baby can calm down, sleep restfully, and mom and dad sleep restfully, things like that. So that's really where chiropractic's wheelhouse exists. The challenge comes in that insurance companies, health insurance companies, are more of a symptom-based model. So it's not that they don't believe in wellness or anything like that, because sometimes you'll hear people or even practitioners say, oh, regardless of chiropractic or medical doctor, DO, dentist, any of it, they'll say, oh, well, insurance companies don't believe in wellness. And that's not necessarily the case. They just don't pay for wellness care, which is unfortunate. Yeah. A lot of times you still can use your HSA or FSA. So if you have a health savings account or a flex spending account through your insurance company, you still actually can use that card for your wellness visits. You just can't use actual insurance. I can't bill it out to the insurance company. But again, that doesn't mean they don't believe in it. They just don't want to pay for it. Because they're on more of a symptom-based model.
So that's probably why most people wait for an injury so they can claim and go in and get it taken care of.
Kind of manifesting the idea of what we do. But of course, I always tell people the first chiropractic adjustments were not delivered to cure back pain and neck pain and headaches. The first chiropractic adjustment ever delivered cured deafness, which has nothing to do with back pain, neck pain.
Oh, wow.
And that's how chiropractic was founded. And I think we dug into that a little bit in our very first episode. But the early chiropractors were treating mental illness and digestive disorders and asthma and, deafness, things like that. So it really only developed the pain-based model with modernization of medicine, how people perceive medicine, and health insurance, that it kind of moved more to a pain-based model where it said, well, secondarily, chiropractors are pretty good at fixing neck pain, back pain, and headaches, even though we were really treating these people for depression. And so at the time that all this was happening, chiropractors had a little bit of a harder time coming up with research-based studies to explain how they were helping people with these other ailments or with wellness. So they just kind of pivoted into the part that was obvious, that we were helping with headaches, neck pain, and back pain. And part of that really comes from the basis that a lot of people who are chiropractors are going to be on the more extrovert side of the spectrum. They're going to be more social individuals, more entrepreneurial in nature because of the nature of being a chiropractor and being with your patients, and you're out in your community. So what it doesn't tend to draw in is people who want to go into strictly research. So there are a lot of med school students who will actually never really get too deep involved in the patient care side of medicine. They'll dive right into the research side and really just focus on that, make a living being a researching doctor. You don't see that a ton in chiropractic just because of the nature of chiropractic and how it exists, because it's a lot more of a personal, interactive type of medicine. So it took a while before chiropractic could evolve into
its own.
Yes, a research-based medicine, which it is now. And now we have really good research, but it took time before the schools basically grabbed a hold of that and said, hey, we got to come up with some research here so that our physicians are protected for the things that they're doing.
And I feel that people should have, obviously a lot of people have a lawyer on hand, right? You should have a chiropractor, even if you haven't gone to one yet, have one ready, so like if you're in the area, right? get Dr. Max and the Healthiest You phone number in your phone. So, you never know when something happens, you know exactly where to go. I see a lot of people also, I have an issue with my shoulder or my knee, and they run straight to a doctor, which nothing wrong with that. But I know, and I think it's because they're uneducated. I feel like for me, if I have a joint pain or if my leg's hurting, it's weird that they would go to a doctor right off the rip for like sciatica, right? Like, because they don't know they're having sciatic pain. I would go to a chiropractor first, find out what we can do there. And then you would recommend me, hey, you know what, this is more than just sciatica. Maybe you messed yourself up. Maybe you tore something, or maybe it's deeper than that. And then you go, is that a correct assumption to start with a chiropractor before you move into straight to a doctor, or?
Yeah, that's a great question. And we are more of a primary care physician. In fact, in most states, that's essentially how we're viewed by the state licensing board.
Okay.
We need to be able to diagnose anything from sciatica to migraine to scabies to cancer. You can't get licensed without having that awareness and knowledge. So we are more of your foundational aspect of the pyramid, and then you're going to go here first. And if we can't help you, we're going to know where to direct you to get you the help you need. That would be the ideal way to use us. The irony is that usually the pyramid gets flipped completely over. People will start by trying to go to an orthopedic doctor first. And a lot of times what ends up happening is when we see a new patient, they're actually telling us we're their last hope, not their first hope.
Wow.
Which is kind of interesting, right? Because it means they've run the entire gamut outside of us first. Maybe they've already even had a spinal surgery and it just didn't get them better. And they're coming to us afterwards. But it's kind of interesting because really in an ideal setting, if not only patients understood better, but even if other practitioners understood better, and some of them do a great job with this, they would say, hey, start at the chiropractor. And if that doesn't work, it's a conservative form of medicine. It's affordable whether you're using insurance or not. So if it doesn't work, then you go to that next level of the pyramid and work your way up to a tertiary provider like an orthopedic surgeon, not working your way back.
And I feel like there's been a lot of possible surgeries that were unnecessary due to the fact that the chiropractor could have fixed that. Like I've heard that with like rotator issues, like a difference between a tear, right? But some of it, right, could have been adjusted way before that. And doctors, I feel, will medicate you way faster than recommending you to a chiropractor. That from my personal experience.
Yeah. And it's all, we're so fortunate because we even see physicians of all different practices in the office here. So Strongsville and its community has been wonderful to us. But worldwide speaking, you're right. They don't all know, or they're not comfortable with it. There's a little bit of fear of the unknown too. They don't exactly know what we do. And one of the other challenges is that not each chiropractor practice is similar. In fact, there's, I think, 7 chiropractors in Strongsville, maybe 6. We all practice different. There is not 2 chiropractors in this town that practice the same way. And that's the challenge too, because then when a medical doctor would go to refer, they don't know which version of chiropractic you're getting. It's not like we walk around with our transcripts, draped around our neck. So it's like, oh, this kid's a C student. Oh,
hey, that's the next commercial, right?
It's all A's. Yeah, this one's
the next commercial.
This is the good one. Yeah. And so because of that, to maybe a medical doctor or a doctor of osteopathy, they might feel it's safer to just say, hey, don't try that, rather than, hey, let's try to find you a good one. And I just had a patient just yesterday who got an MRI from an orthopedic guy who focuses on spines. And the medical doctor, the orthopedic, said, hey, do you or do one of your family members know a good chiropractor? And I thought it was great. And the guy was like, actually, I do. And so he was here and he brought his MRI.
Oh, so he asked the patient if they know anyone in the family.
And it was a disc bulge, but it was not to the level you do surgery on. And it's something we can absolutely help with. And I thought it was awesome because that doctor had the wherewithal to look at this MRI, say, hey, this is a disc bulge, but this is not a surgical scenario. What his plan is to give that patient injections to dampen the pain so he can get through his day, but knows that chiropractic can then be the corrective method to correct the disc bulge. So the patient won't be in as much pain because they're getting that injection, but then the patient will also get correction through our care so that once the injection wears off, they're just better, instead of injection wears off, they're hurting again because they never corrected anything.
At CrossFit Strongsville, fitness is more than just a workout. It's a community. Experience heart, strength, and fun in every session. Overcome your obstacles, get fitter, and laugh along the way. It's time to start your journey today. Visit CrossFitStrongsville.com. The Healthiest You Chiropractic Center is dedicated to helping you live pain-free and feel your best. They offer personalized care for all ages, from injury recovery to wellness. They've got you covered. Start your journey to peak wellness today. Visit thychiro.com. That's thychiro.com. Looking to level up your podcast? Join me on the Podcast on the Rough, where I dive into the world of podcasting with raw conversations, real strategies, and unfiltered insight. Learn the tips and tricks that I use to help top podcasters grow and impact their audience. Subscribe now.
There's a lot of incredible doctors. I think the biggest thing also that I want to point out is that a lot of doctors, you go to a surgeon, they know how to cut, right? You go to a dentist, they know how to deal with your teeth.
Go to a chiropractor, we know how to adjust, right?
You do it adjust, yeah. So it's just leaving the room for the practitioner to recommend outside of, maybe an area that doesn't need to be under the needle, if you will, or doesn't need the medication. Let's try some alternative things. So I think it comes down to a doctor that believes and wants to practice alternatives besides just what they know.
Yeah.
And there's room for everybody. And then, the other thing that I look at is with chiropractor care, when you said there's all these different types, I would say also if you've gone to chiropractor care and you didn't like it, because before I met you, Dr. Max, I would go to chiropractors, and I had a one I stayed with for a while, and I didn't like it. I had nothing really bad, but my side effects, I would say I don't even know if you'd call it side effects, but the way I was being adjusted might have been a little intense for me. Maybe it wasn't recommended for me, or maybe it was, and it was just my certain current condition. I was getting my neck fixed. Like I had a little whiplash from a car accident. Okay. And from what I understand, my neck was like this versus this. Like
I needed a forward curve, right?
So it was a clicker, and it caused tremendous tightening in my muscles. However, it did go away. It was just very uncomfortable. I'm not a fan of the clicker, right?
Yeah.
So I think if anyone's tried something and they don't like it, try another chiropractor. Like Absolutely. Go back and give it a shot. You'll be surprised how different the adjustment feels. Like I feel amazing after adjustment with you, and any one of your chiropractors. you know, so it's just my body feels different. And sometimes I'm sore, sometimes I feel amazing. I think the biggest thing I get from when I'm doing preventative, if I haven't injured myself, is the fact that I can tell throughout, you know, if I go 2 weeks, I can tell when I've kind of out of alignment and I'm like, maybe my body's misfiring a little bit. When I get adjusted, everything is I'm flowing and I feel so like, just so good, like so vibrant, if you will.
Yeah.
And I hope that everyone can get to that stage, because some people are just in chronic pain and maybe they can't get there, but at least the chiropractor will help that flow better.
Yeah. That's a great point. And you mentioned about trying different providers, because one thing that chiropractors don't always get the benefit of the doubt with is that, you know, if you have a bad dental experience, you're not going to swear off dental and never go back to a dentist. You're just going to find a different dentist that works better for you or your family. The challenge with chiropractic is that a lot of times people will try chiropractic once, say, hey, I didn't like this. It didn't work for me. So chiropractic doesn't work for me, instead of that chiropractor didn't work for me. And
I like that.
That's a hurdle that we have to overcome as chiropractors, is to educate our communities in the fact that sometimes a certain chiropractor's technique just in style of practice just doesn't work for every patient. And I'll tell you what, that's heartbreaking for practitioners like myself and the doctors that I work with here, because we want to fix every single person that walks in the clinic. And the truth is you can't. And I wish I could, but just like you can have someone say, you know, I took 2 Advil and it didn't touch that headache. Sometimes chiropractic medicine does not work for people. And it's not common in our office. If someone follows our instructions and follows the care plan and we think we can get them better, it is a tiny percentage of people that fail to respond to our care. But the truth is, there is still a percentage of people that fail to respond to our care. And I would say that percentage is truly probably less than 2% of the people who walk in this building who would follow my care plan. I feel I can get them better. We go through regimented care and it has zero influence on them. But it still has a percentage, and that's really challenging. But that doesn't necessarily mean that chiropractic doesn't work for that patient. It just means that what I'm trying to do and the stuff that I know how to do is not working for that patient. There might be another chiropractor out there who can work better.
Ooh, that also brings me up to something too. Well, first of all, I've been through several phases with you where you've put me on a 5-6 week plan to, like, some people go, I'm going to go be fixed in the first, session, and it's an alignment. Or sometimes, like, we got to keep, adjusting this so it remembers or whatever to stay where it is. But I want to dive into this a little bit, because I've done this to you before as well. How many times do people come to you after maybe they first met you or they know you or any chiropractor, and I need adjusted here. Can you do this? Like, we're almost telling you how to do your job, and that's not what we intend to do. But one is, I don't know why sometimes I do that.
Yeah.
I think usually I'm just kind of expressing to you where my pain is. But I know for a fact that I can come into you and not tell you where my pain is, and you could identify a lot of that just by looking at my feet, right?
Right. But it's and he means like his leg lengths. I actually hate feet, so it doesn't mean his actual toesy woesies. That's gross. And keep your shoes and socks on around my
toe. My middle toe is longer than
So that's a great point. And when you have a patient that's experienced in your clinic, it's a little easier as the physician to allow the patient to direct their care to an extent. When a patient first comes in, we really try to set the tone that, hey, you're here. We need you to trust us. A lot of times we use digital x-rays to show the person how their alignment is and how it needs to be. So you're not even trusting us necessarily. You're trusting your own eyeballs to say, hey, yeah, I'm crooked. Fix that, please. But there is a challenge there when you have patients who are, and it really depends on personality type. I would say that about 3 in every 4 people are going to come in and say, hey, doc, fix me the way you know how to fix me. But that still leaves 1 in every 4 people who are more that like high driver personality type, business people, entrepreneurs, people who work in healthcare. They definitely want to kind of like direct their own
fix
care.
themselves on your table.
Yeah. Fix themselves while you're doing it, essentially. And what I've come to learn over the years of being a chiropractor is that the direction that seems to work best for me is if a patient is adamant about guiding their own care, I will tell them that we can do that. And if it doesn't work, then we'll go my way. And if it does work, great. I listened to you and I treated you the way you wanted to be treated that day. One thing I think healthcare providers on a whole sometimes misfire with is we form an opinion about something at initial response, but we maybe don't do a great job of listening to the patient in their entirety. Mm-hmm. And that goes far beyond just the words coming out of their mouth, right? It's how they're carrying themselves, their demeanor, all of it. And so that's where I think it's important to listen to your patient. Mm-hmm. And if they want to provide a little direction for you on how they'd like to be treated that day, I think that that's completely okay. I think sometimes doctors can get offended by that, almost like it's an insult to their intelligence. What I tell patients, what I tell my two doctors, especially one that's brand new into the field, is that they can't be disrespecting you too much if they're sitting in your office.
That's true.
Already yielding respect to you by sitting in your office and trusting you to fix them with your bare hands, right? And most people neck. You're going to hold these people by their neck and treat them.
Oh, yeah.
Mm-hmm. That is an immense amount of trust and respect. So it's not that they're disrespecting you or they don't think you're intelligent because they're guiding their care a little bit. And again, in a patient like yourself that's been a patient for some time, I think it's completely appropriate to listen to them on some of that stuff. And I think you could even say that there have been times where you'll come in and say, hey, I think this might be good for me today. And there have been visits where I go, I think that would be good. And there have been visits where I go, nah, I think this would be better based on how you're presenting. And if you gave me pushback and said, no, I really want this today, I'd give it to you. Because
what's funny, because there has been times where I'm like, and there's been times where I'm like, oh, this is hurting, and you adjust over here because it's never really the point. It's over here. So I let you, obviously I'm in your care. Also, there's been times where, I didn't want my neck adjusted and you're like, we don't have to do that, and it was just because I just wasn't feeling it that day, but I needed it. Or it was a little stiff. But I think the biggest thing is, people don't be afraid to speak up and ask, or to just say where your pain is. Don't be intimidated by that, but I think obviously it's the good workflow. It's good. I definitely want to ask the question of why are people being adjusted in their underpants on social media? What is going on there? Because I never show up and go, I'm stripping down, Dr. Max.
Yeah, but then you do. I mean, I don't. It's a fascinating phenomenon that, I'd say 90% of social media practitioners for any sort of physical medicine, whether it's, physical therapy or chiropractic, for some reason, if you're a female, you're getting adjusted in your underwear. I can't say I adjust anybody in my underpants here, not my underpants either. So that'd be the flip. That's the flip.
That's the flip. That's the flip.
A patient's not wearing their underpants, only exclusively underpants. I'm in my underpants. Yes. That's the draw. So,
and it's weird because I feel like if people have been to chiropractic care and they see this online, they might think, because it's being misconstrued out there like that, and they're like, hey, I guess I gotta go there and strip down. And especially the problem is, because they are adjusting females. Like, I wonder how many women are afraid to go to chiropractor because of the narrative out there. Yeah. And it shouldn't be that way. It's like, why are they doing that?
Let's say let's say your wife's never been to a chiropractor before, and she's watching TikTok she sees that that's chiropractic, and maybe she's a little body conscious, and she's like, well, I want to go to a chiropractor and this Dr. Max guy, and he's going to ask me to get down to a sports bra and Spanx to adjust me. So I do think sometimes it provides a little bit of a misconception, and look, I understand why they're doing it. Like, it's
reviews, right?
And those chiropractors are trying to draw attention because a lot of them are professional influencers, right? So it's kind of the opposite of what we talked about in the very beginning of the pod here, where we were talking about how I want to be a chiropractor in the field first and then provide this as a passion project, and from experience adjusting hundreds of people a day. In some of those chiropractors' perspective, that is how they're generating income, is off of the social media presence.
Oh, wow. Yeah.
So they're trying to get as much attention to it as possible. The glass half full way of looking at it to me would say, well, at least they're marketing chiropractic. It's not the ideal way I'd like it to be marketed, but at least they're getting the word out there and they're presenting chiropractic in a positive way within their own right.
That's true. They're still educating.
Yeah, they're still educating. It's just so you know, we don't have anyone dressed down for chiropractic. In fact, you know, there's snow on the ground out here behind me, and patients will come in and they'll ask, hey, do I have to take this hoodie off even to be adjusted? We adjust it with whatever you're wearing that day. Mm-hmm. A chiropractor should be able to adjust you through pretty much any of that, unless you're coming in wearing 4 coats or something like that. But really, I could adjust you in any sort of attire. And it's more about the patient being comfortable too. So like if the patient's going to be more comfortable in a hoodie and sweatpants, then come in a hoodie and sweatpants so that you're nice and comfortable while you're being treated. So yeah, I think, going back to it, it's for professional reasons that chiropractors promote it that way. But the downside of it is that in some ways, I think it kind of cheapens our profession a little bit. It gives kind of an appearance that like, hey, it is kind of like a presentation to draw attention to it.
Plus on social media, from a producer's perspective, the other issue is a lot of this is a long form video that has been shortened. So when you got micro content, it gets misconstrued, it gets seen differently. And when you cut something out, it might be like, oh, this is maybe all sexist, or maybe this is what it is. And really the whole video, if you watch it in its entirety, is not that. Like maybe
educational, right? But
maybe they stripped them down to show they just
scroll past it, and they're just like, every chiropractor video that I see the thumbnail on YouTube or whatever, it's just some guy adjusting a girl in her undergarments.
So my wife thinks that I come to you. If she never came to you, she might be thinking that I go and get stripped down to my underoos. Because, she'd be like, what do you do there?
Yeah. To be clear for everybody, we have windows to the outside with all of our treatment rooms. So getting down to your underpants would be pretty awkward because everybody outside those windows.
In the parking lot, people, that's the next commeral. Someone pulls up and they're like, honey, we're not going in there. Like, it shows me.
I thought I was going to my underoos. thought I was going to a chiropractor. What's it doing?
So we got 3 minutes left. Is there anything you want to plug? And if you want to touch base, just a little bit how you talk about after I get adjustment, I don't have to take it easy necessarily all the time. I can go into my workout and it's recommended.
Yep. Yeah, so we've got a gym right in the back of the chiropractic facility here. I was just in there before I came here to do the pod here. Usually, research shows that you got about 5 minutes after your adjustment where your ligaments are going to be a little bit slack before they kind of tighten up and hold your new alignment. So that means you wouldn't want to quite literally hop off the table and right into a CrossFit workout. But in our practice's case, we're adjusting you, and then we do any associated therapies. So muscle stimulation, laser, vasopneumatic compression like Normatec, massage, stuff like that. And by the time you'd be done getting off the table with that, it's going to be longer than 5 minutes. You're ready to go. You're ready to go to the gym, exercise, do whatever you need to do in the day, pick up your kids. And that's encouraged, actually, because a stronger you is harder to hurt. And you're now strengthening yourself in the new alignment we just gave you.
Well, I like that.
People are afraid to skew their adjustment right away because they're like, oh, I'm going to throw it out of whack working out. And the truth is that would only happen if you're working out incorrectly with poor form.
Yeah.
As long as you're moving properly, you're actually gluing in place and strengthening the new version of you that we just gave you. So you're actually helping the whole process along. So
the healthiest you.
Future pod. Yeah. The healthiest you. Exactly. So, well, I can't thank you enough, Zeb, for getting this thing back rolling for us and giving us an opportunity to get jacked and cracked back online here. And I really look forward to future content too.
Yeah. It's going to be great. I'm looking forward to it. We got a lot of exciting stuff coming up, and we're going to be covering a lot of topics. So if you have any questions, feel free to let us know. I'll put a link below this podcast episode where you can contact us and just give us your questions, and maybe we can bring you on as a guest someday. We'll talk about it.
Thanks for tuning in to Jacked and Cracked. If you enjoyed today's episode, don't forget to subscribe and leave us a review. Stay aligned, stay strong, and we'll see you next time.